and has meaning. Each moment is meant to be experienced and cherished. Welcome to Anxiety Simplified Podcast. I'm Joanne Williams, and I'm going to share ways to refocus this anxiety energy to a more productive and effective way to go through life. You already have all the tools. I'll just remind you how to use them. We'll be tuning into your own power to choose and find more joy and peace. Let's get started remembering this wisdom.
Well, hello, everyone. Joanne Williams here for Anxiety Simplified. And this is going to be part two to a podcast we just did with Maureen Curis about end of life planning or having the talk. This is more about understanding who's paying for what with Medicare benefits or understanding so that maybe you can help your family member to make more of a long-term plan for if there is a parent that is going to need additional help or a child even or a grandmother or grandfather. So I'm just going to do a little summary here first, but we're going to really discuss, and I hope you'll learn what most Americans do not know about who is paying for the living situations towards the end of life. We're not talking about end of life on hospice. We're just talking about, kind of way before that. And I think it's a must listen for family members. But the summary is you're not dying yet or even close to death's door, but you just can't walk well and not being able to fix your own meals or falling down often, which really can become the killer if you break a hip. And if your long-term spouse can't care for you anymore or can't pick you up off the floor, what do you do? What are your choices? So, what can families do to help? What are some choices ahead of time that you can look into and make? What does Medicare pay for? Do they pay for an assisted living facility? Most people think they do. And I'll tell you right off the bat, they don't. So, listen up. Much more on some of the costs that you may not be aware of for in-home care or assisted livings, things like that. And making sure you do have your medical power of attorney done. Like I just said, we did a podcast about end of life planning. Critical, critical, critical. If you want to have your wishes known, you got to have it written down. The question of the day, what are the choices that I need to know about so that I do get my wishes and understand where I want to be and live and who pays for it? And I'm going to start off with a little story, a true story of a neighbor. I think she's about 90 years old. The fire department or ambulance comes at least 1 to 2 times a month, probably more frequently. And she refused to leave her house, but they come to pick her up off the floor. She can't get up. And her son does visit almost daily. And she has a caregiver part of the day, but still the fire department comes and the ambulance comes, usually both of them. And she does not get taken. I think, once or twice she's been taken to the hospital. Most times she isn't. So what are the choices for this son? What is he supposed to do? And unfortunately, this is a very typical scenario. I heard it all the time. And there's not a lot the son can do unless he can convince his mom. I think he finally was able to convince her to get somebody to come in to make her breakfast and make sure she gets safe in the morning. But sometimes that is all we can do. So let's just talk about some of these choices. Some of the reasons why I know this, I did work as a medical social worker. I've been a licensed clinical social worker for 30 years, but worked in a lot of different environments. And one was as a medical social worker in one of the largest medical groups in Palm Springs, California. And they were really all about preventing hospitalizations. And I was help create their social services department that gave services to keep them out of the hospital. And that was about 10 years ago. I think I've been out of there 5 years. And it's still going today because it works to help give resources, social resources, so people understand they have choices instead of just using the emergency room or the hospital as a place to go because I don't know what else to do. with grandma or mom. And 70% of people turning 65 can expect to use some form of long-term care during their life, according to the AARP. So, what I really had seen a lot of, and I've been in every kind of household you can ever imagine or not want to see, but it's usually like the two spouses, one struggling to take care of the other one, while it's actually just killing the other one trying to take care of. They can't pick them up off the floor anymore, but they'll hurt their back trying. And the children care, but maybe they live 1,000 miles away, or maybe they do offer some financial support to help, which is great. But today I really want to talk about some of those kinds of things, what a family can do, and talk about what Medicare does not pay for and what to look for when you are choosing your medical insurance. So, what is Medicare? I was always surprised to hear people really don't even know what it is. It is a plan, medical plan that we pay into in America. And at 65, it becomes your health care. There's really several things I want you to know about what they pay for and what they don't pay for. But I want you to know that even at 65, you still pay a monthly premium. A lot of people don't realize that because it comes directly out of your Social Security check. But I think it's about $140 now per month for your health care. There's really two kinds or plans, I'm going to call it. There's probably 1,000 plans, but there's the traditional Medicare, which pays for 80% of the cost of whatever medical treatment you do, and the other 20 you pay for. So it is not free. It is, you still pay in every month, and you pay 20%. If there's a hospital bill or, doctor's bills or whatever it is, you pay 20%. Unless you have what they call a Medigap plan, that would be your secondary insurance that would help pay whatever Medicare does, that 20%. It again, you would pay additional monthly fee for it, usually in the $200 range, to have that coverage for that 20%. There's also a plan that's called Advantage Medicare plan. And it is, they pay your choice of a doctor, choose a doctor that has Medicare, and then they will pay that doctor a flat fee per month. They call it capitated, to take care of you. Whatever's needed, they are supposed to be taking care of it. They can refer you, of course, to specialists and all that, but they manage your care. And there is only a certain time of the year that there's an open enrollment, and it is usually October to December. Sometimes they shorten it, sometimes a little longer, but you got to be able to change anything or change plans, you've got to do it in open enrollment. After that, you can't unless you move, or there's some ways, but generally you really can't change it. So it is important each year you look at what you've got and change it if you need to during that time. There can be additional benefits to the Advantage plan because there are some plans, and you need to talk to a licensed medical insurance company provider. Not like just the one that AARP, which is United Healthcare. No, you want to talk to one that sells all of them, that can look at all of the individual plans so that they can give you the benefit that you need. And that's what I would say to a family member. You need to help your mom, your dad, whomever you're helping, figure out for that year what's coming up. If you need a knee or a hip done, you're going to have to be in a skilled nursing facility for a few days or weeks. That benefit is going to make a difference how much out of pocket you pay. So or if you're a diabetic, you want to look at, who pays best for insulin or whatever your needs are. Look at what your needs are, and that's what you talk to your insurance person about. But another benefit of the Medicare Advantage plan is that some of them will give you or pay for your monthly Medicare healthcare payment. If I said it was 140, some will actually pay 110, $140 back each month on that cost. So it really doesn't cost you anything. So that can be a real money in your pocket if that's the kind of plan you want to use. They also seem to give more benefits. Like some of them, a lot of them have transportation benefit to medical appointments and sometimes other appointments at pharmacy, and they don't cost. So you get so many per year. There can be some other things too, lower copays on things. So it's really important to check those out and see what works for you, because Medicare does pay for a skilled nursing facility, or what is we might think of as a nursing home or rehab facility after you come out of the hospital. And that's one of the differences too between a Advantage plan and a Medicare plan, if that is still the truth about it. But to be able to go into a nursing facility, you have to be in the hospital 3 days if you have straight Medicare. Where Advantage plan, you don't have to stay 3 days, you can go directly in. So that was one of the stipulations, which I always thought was kind of weird, but that was the way it was. But so again, according to the benefit of your plan, they will pay for a skilled nursing facility if you're progressing. So usually it's physical therapy to get back up on that new hip or new knee, things like that, maybe OT because you can't reach or you're not stable. There can be other reasons, but you have to be progressing or they will not pay. The average nursing home or skilled nursing facility, it's called, averages about $225 a day. That's for a semi-private. So it goes up from there for a private room. And the reason why I say this is because you need to watch the number of days that they'll pay for. Or if you're saying, no, I'm not having my mother leave because she hasn't progressed, blah, blah, blah. And they'll say, that's fine. But you'll just have the option then to pay the $200 and $250 per day. And you're like, what? I thought Medicare paid for this. Yes, they do if they're progressing and only for a certain number of days. So you just have to know what your policy does state. The other place I should say that sometimes, families get very disconcerted about, because if their family member is not progressing, and that means they may have to go to a long-term nursing facility, basically paralyzed, they can't breathe on their own, things like that, where they really need 24-hour care to turn them every 2 hours and things like that. It's really expensive. And again, usually it's only a few days or weeks for that. And that's what a lot of times will push people to need to get into Medicaid, which is a state federal funded program, or California's Medi-Cal program, to pay for long term, like even in a nursing facility, if they don't have any other way to pay for something, a lot of times Medicaid is applied for, but it's very specific things that you can't have to benefit, to be able to enroll in it, like a motor home. You can't have mineral rights. You have to basically spend down your resources, or you can talk to certain types of lawyers that can figure out how to do it for you, so that you're not spending down all your savings to be able to take care of the other spouse. So definitely there are things you can do about that. The other things that Medicare pays for is hospice, end-of-life care, and palliative care, which is palliative care is there really are no cures. There's just to keep, you can go to treatments though, or go to a doctor or do some specific things just to maintain. And then hospice is if you have a diagnosis for two doctors saying for 6 months or less of life expectancy. But what I have seen working at three different hospices is that a lot of times people get better. They get really good care on hospice. Then you don't go on it the last 2 days generally. And you get a nurse weekly, or maybe in the beginning several times a week, a social worker to help deal with emotional issues. And what I see is a lot of patients actually get better and they come off hospice because of the good care they get. They do not just give you morphine to zone you out and die. That is just a misnomer. And they can also provide respite care for the caregiver that's exhausted. And that is a huge, huge benefit. So that is another really big benefit, and it's limited for sure. Medicare also pays for hospitals and as well as medical doctors visits, can pay for a home health aide. It's very limited for a short time, and it's not a caregiver. They do a light work around the home or make a sandwich so that you can have a meal if you're unable, but they do not pay for caregivers. They also do skilled care, they call it, for a nurse to come out if you've come out of the hospital with an IV or you have wounds that need to be bandaged regularly, or you need to learn a skill yourself. They also will come into the home, but it is not, again, for caregiving. So, what does Medicare not pay for? And this is where I seems like I get families that get very angry because they do not pay for an assisted living, which is usually a larger facility that has maybe 100 or 200 or more residents, that you have a little room, bathroom, and there's dining room generally, and they you go there and have your meals, 3 meals a day. But the average cost is about 4,000 per month. That's average. And I mean, it can go up to 20,000 a month. It can get very pricey depending on where you live, but average about 48,000 a year. Understanding Social Security average is about 1,200 a month. So we're talking an extra 3,000 or so a month that's needed if you're going into an assisted living. And again, Medicare does not pay for caregiving or caregiver services. And the average cost of that can be about the same, or even like 50,000 a year, or about $25 an hour. And they usually have a minimum of about 4 hours per day. So think about that, $100 a day. It is not cheap. In one of the last videos, we did talk about an advance directive, which names somebody to have your own medical wishes taken into account when medical decisions are decided. That is really, really, really critical and important. And I hope you have that talk. And if you want to hear more about somebody that can help you with this, listen to my last video with Maureen Curis. And she actually has groups and helps family talk about this important talk. It's really important. But Alzheimer's is on the increase. It's a terminal disease of cognitive dysfunction, but it usually does not kill the person. Something else will take them first. But the concern that I really have and heard is that 80% of caregivers who are caregiving for somebody with Alzheimer's succumbs to an illness before the person with dementia does. So again, family members, you got to do heads up here and start making some plans. What happens if mom can't take care of dad? And even worse, right now with COVID-19 going on, we've learned that 80% of caregivers or spouses now are looking at the suicide rate has doubled with caregivers, unpaid caregivers right now. So you can imagine how overwhelmed somebody must be to know they're leaving somebody uncared for. But that's where we need to help our unpaid caregivers right now. If you've got a mom or a dad or grandma or grandpa, they need to be called. You need to do a little bit more right now because they get very tired. And this is a pretty normal scenario that I saw. And my job really was to advise and give resources for caregivers and programs and things like that. There can be adult daycares that the person with Alzheimer's can go to, and they can go, usually it's 1 or 3 times a week, and it can really help the caregiver out so that they have a day to be able to hi, my little buddies here, to give them a little break. Speaking of emotional support animals, I certify for emotional support animal, and this is my little guy. If you see the video, Riley. And I'm telling you, for dementia patients, I've never seen anything like having an emotional support animal to be able to help somebody with dementia. If you get the dog or cat or whomever early enough, so that they can really help with the agitation features. Dementia can really have some agitation, especially towards sundowners. They get confused and they get a little agitated and fearful. Having a dog sometimes can really help with that. Anybody wants to hear more about that or how to qualify, you can go to esapros.com. They can be really helpful for that. So, kids, how you might be able to help your parents for things that Medicare does not pay for. Because I think there are a lot of things that could help. Like you could pay for that adult daycare. My husband and I had his father live with us for the last 3 years of his life, and he had Alzheimer's. And it is really nice if somebody could pay for that, if your mom or dad or whomever can't afford to pay for it, because and encourage them to try it 3 times. Oh, just go one more time. That's all you have to go. If you don't like it, you don't have to stay. They will like it because it's socialization. They do things. Everybody's got Alzheimer's there, and the caregivers there, the people there, they understand how to deal with them. Because I think that's the fear. They're afraid they're going to go around other people that might make fun of them or not understand. They just cannot do the things they used to. But encourage it. Or maybe your mom's resistant of taking your dad or something to a place and dropping him off, but I'm telling you, it's just for her to get out for that hour, 4 hours, whichever you choose, for her to go get groceries and just sit and have a cup of coffee is priceless. So if you could help pay for that, it's not cheap. But it usually at the senior center. Most places have it at the senior center. They're really on every town just about has an area aging it's like AAA on aging agency. There's the 3 A's that you can check into, and they'll give you more resources, and you can look online as well. You could actually put a camera in your folks' house, and then you can tell what's really going on. Because what I saw was that most times if you call your mom and, oh, how things going with dad? Oh, they're all great. Everybody's good. No problems. And then she goes and just drops down on the couch dead, tired. You're not getting the true story for sure. With a camera, you can see it, and they'll forget about the camera being there. They'll forget that it's there, or it's kind of like activated at certain times, and then you can tell. There's also those life alert little buttons. You can get one that they can press the button, it'll call for help, or on their wrist, and that can be activated. They now have cameras too through their system. And the same one with the phones that you can have if they fall down and just say, I need help. That can activate a camera as well. Or they will call you first. They don't necessarily have to call an ambulance if you don't want it. And it is important to talk about a do not resuscitate or other forms of end of life choices like a pulsed POLST. That is a doctor's order about if they do not want CPR and things like that. And then they don't have to call 911 on that little button. You can call whoever you want. You have like 3 people if one doesn't answer. So you could pay for that life alert kind of system in the house that can come with a camera that you can see in there and tell more what's going on. And if you just get the camera, you can say, oh, we can have Zoom now. We can talk every week. And then you can really more see what's really going on. Also, for one thing we found for the Alzheimer's family or our client is you can go to Home Depot and get these door chime magnetic locks that if the door opens, the chime goes off, so that your mom or your dad, whomever at night, because Alzheimer's patients do have a tendency to get up at night because they don't know if it's day or night. And you could hear if the door opens, it'll chime. Same with the front door. It'll have a different chime and you know what's going on, or that could alert you through the camera. So there's a lot of different things that you can do to help. Paying for a caregiver, even if it's one day for 4 hours, that would be so helpful. And then your mom or dad could just sleep. They knew their spouse or your mom or dad was taken care of. They could relax. That lack of just letting go, I think, is one of the reasons they succumb. You can't do this forever, and they will swear they're doing just fine. I heard it all the time. So no, there's things you can do. It's the way you ask. So I hope this helped. If you have some questions, you're more than welcome to put them on Facebook or other ways to get a hold of us. We're always here to make sure you have the resources that you do need. I do have a talk on Facebook on Saturdays, and I just found out I'm supposed to put it on my business page. So I guess it'll be on Anxiety Simplified 5 at Facebook, and on Saturdays at 1 on the East Coast. And so I'd love to hear more or your questions. Hope this is helpful. And always make sure you see our other podcasts on iTunes or at anxietysimplified.net. All for now. Bye-bye now.
Thank you for listening. Please support our podcast by rating, reviewing, and subscribing. Please, to show your support. And remember to use and practice a skill we shared today to feel the joys of life. Remember, you can always call us 760-485-6784 for that free 10-minute consultation where we can discuss your next step. Or you can go to our website at anxietysimplified.net for more on how to get certified for an emotional support animal today. And remember to share the love.